where did you learn more about VR? Because this is a tech company, so I assumed you were
Sure.
not a programmer, you were not a developer, you were not a designer.
I'm not. So in our team, we have 9 people,
Mm-hmm.
and we cover pretty every field, every element, of the pipeline of the development. We have biomedical engineers working on the biomedical device section. We have game designers working on specifically the design of the game and the experience.
Mm-hmm.
We have software and virtual reality developers working on that even since the past. We have business advisors. We have specifically VR technicians.
But you also need, I
And
assume, so sorry to interrupt you, you may also need some kind of anthropological and sociological advisors and some kind of consultants on
obviously,
that area, no?
obviously, obviously, yes. We work in strict contact also with the psychologists, with doctors, and we are building also and expanding our board of advisors with people working in the VR since for the last 30 years. So we had the opportunity to speak with them to refine our project, to understand what are the pain and gains of our solutions. And we went through 3 accelerator programs that are specifically dedicated to healthcare. So the first, the Merck accelerator program in Darmstadt. Next, in the Texas Medical Center in Houston, in the US,
Mm-hmm.
which is the biggest medical center in the world. And the program was definitely dedicated only to digital health. And we are now in Accelerate in collaboration with Copenhagen. So we are continuously learning. We are going deeper in the potential of virtual reality. Obviously, what we are building is an interface now between the research, the biomedical device, and the how we can say the smart business application. Because what I want to say is that there is a huge amount of knowledge about virtual reality in academia. But in academia, also based on my experience, there are a lot of ideas, a lot of informations, but they are diluted. They are not user-friendly, if we can say. The goal of a startup is to make all this knowledge very immediate in the experience, to realize a product that is user-friendly, easy to use, easy to apply in the economics of the world. So the startups is definitely a bridge, a transfer of technology that is coming from the academia to the real world society. And it's something very needed.
And from people who are doing that transition or wondering if they have what it takes to do this transition, is there any book, any kind of main content that what's the main thing that you read or learned while doing your own transition?
We read a lot of books. We definitely had a lot of references, but I would suggest, for example, to study a little bit the researches by a psychologist, an Italian psychologist, which is one of the pioneers of virtual reality in healthcare, which is called Giuseppe Riva, R-I-V-E, which is definitely propose groundbreaking visions and researchers in virtual reality and digital health. This is a very good starting point because he's also specialized in very immediate communication of all this stuff.